All right, we should be live, Allie, if we want to go ahead and get started.
Can you share? It says I can't share my video because the host has stopped it for some reason.
Oh, one moment, please.
Okay. Good morning. Hi, everyone. Just give us 1 second. I,
Um, There we go. That should work.
okay. Oh, there we go. There I am. All right. Good morning, everyone. Thank you so much for joining on this early Monday morning. Hope everyone had a great weekend. I'm just going to kick us off. Welcome. This is the program overview for AAA Outreach and INA staff for the Walk Cares Fund. So my name is Allie LaFontaine, and I am the AAA program manager. I'm going to introduce Kristen. You want to introduce yourself?
Yeah, hi, everybody. My name is Kristen Mackey. I'm the Community Relations and Outreach Program Manager for Walk Cares.
Thank you so much. Sarah?
Hi, everyone. My name is Sarah Cleland. I use she, her pronouns, and I'm the LTSS Trust Commission Program Manager here with the Walk Cares Fund at DSHS.
Thanks so much. Good morning, Ariel. Hi.
Good morning. Good morning, everyone. My name is Ariel Finney. I use she, her pronouns, and I'm the Law Cares Policy and Rules Manager. I'm very excited to be here today.
Thank you so much. I'm also going to pass it on to Kathy Knight to give us a just a brief introduction and talk about why we're here just briefly and why Walk Cares matters to AAAs. Good morning, Kathy.
Good morning. Thank you, Allie. Welcome, everyone. I'm really excited that we have this opportunity for the AAA network to be meeting with the Walk Cares team and to really help you understand the program better, just some of the basics, the relationship that the area agencies are going to have with the Walk Cares state staff and the program at that level. So it's a great opportunity for those of you who will be doing outreach or already doing outreach, and for staff who are part of the Community Living Connections Network who'll be answering questions. And, we know the AAAs are the experts in long-term care, so we already have a great start there. But this will be an opportunity for all of us to be clear on the message and help be as effective as possible in communicating the message about this important new program. So welcome, everyone. I'm glad that you could be with us today, and I'm happy that we're recording it so folks can use this for future training opportunities. So thanks again.
Absolutely. Thank you so much, Kathy. Yeah, and we'll also have this shared on our SharePoint site once we get that up and running here within the next week or so. So yeah, great. It's great we're recording it. So, all right. I'm going to go ahead and dive in here. So before we kind of dig into the program details, I want to talk briefly about why the program is needed. Basically, in short, because of the way we have paid for long-term care up till now hasn't really been working. So even though 70% of us will need long-term care at some point in our lives, most of us, as we know, can't afford it. So the annual cost for 20 hours of home care per week is just under $36,000 per year. And other types of long-term care are even more expensive. The median household income for Washington seniors is just about $56,000 per year. Family caregivers have to step in and often fill that gap, either with their own savings or providing unpaid care. And almost half report a related financial setback, that they spend an average of 25% of their own income on care expenses. Many have to leave the workforce even early to provide care, and caregivers 50 plus who do this lose on an average of more than $300,000 in wages and benefits. Businesses in the economy are also impacted. Most caregivers work full time, and 61% of working caregivers say their care responsibilities do impact their job, often having to come in late, leave early, reduce their hours, maybe even turn down promotions, quit or retire early. And when a working caregiver does leave their job, it even impacts the employer. It costs about 1.5 times their salary to replace them. Next slide, please. So here we're looking at a program timeline. So just to kind of back up a little bit with the challenges in mind, with those I just mentioned, and that we're facing a projected doubling of Medicaid long-term care service costs in 2040. Washington State Legislative Executive Committee, known as the JLEC on Aging and Disability, began a search in 2014 for long-term care public policy innovation that would do like 4 things for us. So 1, preserve and protect the Medicaid program budget, offer affordable long-term care service insurance coverage. 3, provide financial relief to middle-class families and their caregivers, and also be financially viable and sustainable for the long run. So the JLEC spent several years working with stakeholders, policy experts, the actuaries, to explore both some private and public solutions. And after an extensive research on each of these approaches, the findings were pretty clear that a program like WellCare's Fund that covers everyone, similar to Social Security and Medicare, is the only way to provide affordable coverage for all. So we also know that universal coverage, where everyone participates in a program, is best practice in public pension, healthcare, and long-term care insurance programs in capitalist countries throughout the world. It ensures programs can cover everyone at a low, stable rate, regardless of their age, their gender, or their health status. So with that research and best practice in mind, then in 2019, the legislature enacted the LTSS Trust Act, which created WellCares. In 2021, and 2022, the legislature made improvements to the program coverage and benefits, and workers began earning that benefit in July of 2023. This year, the legislature gave workers the ability to take their benefit out of state, so we added portability. And then in July of 2026, the benefit will become available to all those who qualify. Next slide, please. Great. So WellCares Fund can help. And so let's talk a little bit about how the WellCares Fund can help. WellCares is a universal long-term care program in Washington State. It's an earned benefit. You contribute for a certain amount of years to qualify for that benefit. It's self-funded from the workers' contributions, which go into a dedicated trust fund only to be used for the program. Workers contribute 0.58% of every paycheck to WellCares. So you can see here what this looks like for a typical worker who makes just over $50,000 a year. They would contribute $291 a year. That works out to about $24 per month. You only contribute while you're working, and contributions stop when you retire or if you become unemployed. Everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefit, there are no copays, there's no deductibles, you never need to file a claim. We'll connect you to a contracted provider for services that you want, and then you're going to pay them directly. Next slide, please. So here's just a visual of those contributions across the career, what that might look like at different salaries. Typical Washington income is just at that level in the green there, right in the middle. So you can see that $290 in contribution each year totals out about $8,700 over 30 years. So, and then you can look at for 75,000 and how that adjusts out over 30 years is just a little over $13,000 a year. And just keep in mind that that 36.5 is adjusted with inflation. Okay. Great. Thank you. So who contributes to WellCares? So almost all Washingtonian workers contribute to WellCares. To determine whether someone counts as a Washingtonian worker, we look at whether their work is localized in Washington. And determining whether work is localized in Washington can be a little bit complicated, but because we use the same definition as the state's paid family and medical leave program, that gives us some easy rules to work from. And those are, okay, so workers who are included in paid leave will also include in WellCares unless they have an approved WellCares exemption from the Employment Security Department. That means that if your work is not localized in Washington, you are automatically not included in the paid leave or Washington Cares, and no need to file for that exemption. Federal employees are also automatically not included. Employees of tribes are only included if the tribe opts in, and self-employed people are only included as well if they opt in. Other workers can get an exemption from WACARES, which they must apply to the Employment Security Department to get. And some workers can apply for an optional exemption based on meeting certain criteria conditions. This includes workers who live out of state, maybe temporary workers with a non-immigrant visa, spouses of registered, domestic partners, or active duty military as well. So these 3 exemptions were created for groups of workers who would be unlikely to qualify for or use their benefit. They're available on an ongoing basis and they are conditional. So the person must continue to meet that exemption criteria to maintain that exemption. There are also 2 types of permanent exemptions, and those are, the first one is veterans with a 70% or higher service-connected disability rating who have access to some nursing home care through the VA. They can choose to apply for a permanent exemption. So these applications are available on an ongoing basis as well. So there's also that second exemption I was speaking of is available for workers who have private long-term care insurance before November 2021. These applications are no longer available though. So under current law, workers who already had an approved private insurance exemption will continue to be exempt permanently. So let's talk real briefly about qualifying for coverage. So everyone contributing to WACARES fund more than $500 per year is earning the benefits, part-time and temporary workers included. But contributing for a certain number of years, you qualify for the full $36,500 benefit. So there's 3 pathways to meeting the contribution requirement. The first one there is the early access for workers who have not yet earned a lifetime access, but have a care need while working or soon after leaving work. So that would be 3 of those last 6 years at the time that you applied. There's a lifetime access to workers who contribute 10 years without a break of 5 or more consecutive years. And then there's also a fast track for those near retirees. So those are for folks that are born before 1968, near retirement as the program begins, and therefore unlikely to qualify for that 10-year pathway. They earn 10% of benefit amount for each year that they work. So for example, if you work and contribute for $500 for 3 years, then you'd earn 30% of your benefit amount, or just under $11,000, adjusted with inflation, obviously. Another example would be you could work for 500 hours after contributions start in July and then retire at the end of 2023, and you'd still earn 10% of that benefit amount. And then that last example is near retirees will have a permanent access to whatever percentage of the benefit amount they earn at any time they need care. So they're also available to qualify through one of the other pathways if they do meet those requirements. So the benefit is flexible. So once workers meet the contribution requirement and need help with at least 3 activities of daily living, they can get access. Excuse me, I'm sorry, my Teams is popping up. So they need to meet the 3 activities of daily living, and they can get access to the $36,500 budget for services and support. That benefit will increase over time with inflation. With WACARES, workers get the flexibility and freedom to choose the services and supports to meet their needs. That could mean an in-home care or residential care, but it could also include other things like home modifications to make their house safer, assistive technology for things like medication reminders, fall detection, PERS, things like that, that can help with some of their care needs. WACARES is designed to help people age in place in their home as long as possible. I mean, that is what most of us want to do, and what we'd like to do if we have those right supports in the right place at the right time. So WACARES is structured to support family caregivers. So you can choose someone who you would otherwise be caring for you on an unpaid basis to get trained and be paid. Even your spouse in this case. So WACARES can help lessen the impact of family caregivers by paying them for their time and making sure they can get other support services as well. How far will the benefit go? So we do get asked this a lot about how far the benefit will go. And as we know, it won't cover 100% of care for everyone, but it would cover the amount of in-home care an average Medicaid client uses for roughly a year. So about 1/3 of people need care for a year or less. And for those people, WellCares may be able to cover all of that care that they need. For others, WellCare provides the family with immediate relief and time to kind of plan for those future costs. So here's some examples of how someone might use their benefit. They could pay a family member to care for them for about 10 hours per week for 2 years and get supplies for a total of $36,500. Or that second example there, they could choose services to help them stay safely in their home. They could purchase $15,000 worth of renovations like bathroom modifications or maybe a real wheelchair ramp to improve some accessibility. They could even get an electric wheelchair, maybe even a scooter, and have meals delivered for 3 years. And that totals out to about $26,800. And then that third example there, someone who needs long-term care due to an unpaid injury, or excuse me, unexpected injury, could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for $34,600. So those are just some examples of how it will work. I want to just talk just a second about portability. So we also have some great news from this last legislative session, and the legislature passed a new law allowing people to take their WellCares benefit with them if they do move out of state. So under this new law, starting in 2026, Washington workers can choose to continue participating in WellCares Fund if they move out of state. To become an out-of-state participant, workers must have contributed to WellCares for at least 3 years, in which they worked for $500 each year, and must opt in within a year of leaving Washington. Like other workers, out-of-state participants will continue contributing to that fund during their working years. The state will create a process for out-of-state participants to report their earnings and pay premiums, and also focus on making it easier for those participants. Benefits will become available to those out-of-state participants starting in 2030. So WellCares is a cross-agency program, and multiple state agencies have responsibilities in designing and developing and implementing the program. If you have any questions about exemptions opting in, that would be ESD is the right place to go for that, Employment Security Department. And then if you have other questions about WellCares, you can connect directly with DSHS. You'll also work with DSHS in the future as you apply for benefits and get the your care assessment completed. HCA there in the upper right has responsibility for paying providers. And then the Office of State Actuary is responsible for ongoing actuarial analysis and making sure that that fund stays solvent. So here's our beneficiary roadmap, and this is a roadmap for the process beneficiaries will follow when accessing their WellCares benefit. Just keep in mind, this is a draft version. We're still determining all the details of what this will look like for the beneficiaries, but this should kind of give you a good idea of how that process works and how the flow is. So first, starting on one there, the lower left, beneficiary will gather their information on WellCares through outreach and materials from DSHS, ESD, AAAs, and other community partners. And then moving down the line there, second, the beneficiary will create an account in our benefit application management system, which we are calling BAMS, another acronym, and apply for benefits. If they need support with their application process, they'll be able to get help from DSHS or their AAAs and other community partners. And then the third step there, ESD will check with the contribution history. So they determine that their status is and make sure that they're actual qualified individual based on that pathway. Then DSHS or their beneficiaries AAA will conduct an intake. At that point, they'll determine if a virtual assessment can determine eligibility or whether they're going to need to do an in-person assessment if required. And then DSHS or the AAA will conduct an assessment and determine their eligibility, the beneficiary's eligibility for services. The fourth step there, DSHS or the AAA, will help the beneficiary understand their options for services and how to find a provider, provide any information they need on transitioning possibly between WACARES or Medicaid or even other long-term care services, if that's part of the process. And then finally, they'll begin using their benefits. So DSHS will field any questions about things like the provider pre-authorizations, refer beneficiaries back to AAAs or other community partners if that's appropriate. And AAAs will help beneficiaries and their family understand options for maximizing their WACARES benefit, help them find additional resources, and transition from WACARES to other services once that full benefit has been used. So thank you very much. I think the next slide, I'm going to pass this on to Ariel so she can chat a little bit about some rulemaking. Thanks, Ariel.
Thank you, Allie. All right. Well, let's see here. So I'm going to talk about DSHS rulemaking as it relates to the WACARES Fund program. But please know that we have rulemaking happening with Employment Security Department regarding qualified individual determinations. And the Healthcare Authority will be doing rulemaking for WACARES Fund for their portion of the program starting in 2025. So today, as we're talking about things, just recognize and hold in your mind here that we're talking about DSHS rulemaking, which is really going to be addressing eligibility for beneficiaries, looking at provider registration, provider requirements, minimum qualifications. We'll be doing some appeals here in the future, things like that. So just to give us some context here. But I'll start with our timeline, just to give you a sense of where we're at today. We filed 4 CR 101s back in January of 2024. With that, we had kind of a general provision section that we know we're going to be using for definitions for pointing out where HCA and ESD's rules are going to be. But we also have 101s posted for assessment and eligibility, provider registration, and I think we broke out that assessment and eligibility into 2. I think we have an intake one as well. So we have 4 101s posted, and with that, we started our listening sessions back in March of 2024, and we completed those in July of 2024. We used those listening sessions as an opportunity to gather feedback from folks, and we had a really great showing from Area Agency on Aging staff, really great voice there. And this really helped us understand as we approach these topics, kind of what are some things to be considering. And of course, we have a long list on our end, but it's really helpful to be hearing from folks with different perspectives or different ways they're going to be engaging with the program to understand what will be needed or what we need to take into consideration. So we have those listening sessions currently on our website at WACARESfund.wa.gov. And I'll turn to Kristen for that clarification. But we have those recordings available. Certainly, if anybody is interested, you're welcome to go back through and look at them and then submit any comments that you'd like. We are currently drafting both the beneficiary side of the rules as well as the provider side, recognizing that there's some topics we're still working through, and I'll talk about those here in our upcoming projects. But we're making progress. We have our initial drafts right now, and we expect we'll be sending those out to interested parties as an informal review, probably in the next month or 2, depending on how our drafts go and our internal reviews, what we find there. But we're really excited to be seeing stuff come, start on paper and kind of come to life for us. So stay tuned for that. We should have those out pretty soon. We're hoping to file our CR 102s here late 2024 to early 2025. I think we're on track for that, and our timeline is kind of ambitious with the review period, but I think we will meet those deadlines. And that allows us to have rules in place, particularly for provider registration by summer of 2025. And that will hopefully allow people to start putting processes in place, both on the program side, but also on the provider side of recognizing, what are the minimum qualifications that I need to meet? What's the registration process? What does that look like to set us up for a successful registration completion and a good provider pool by go live in 2026? So that's what we have been up to so far, but we do have some upcoming projects I expect we'll be filing 101s on as we know more and kind of get our heads wrapped around these subjects. But we expect we'll be working on rulemaking for appeals for both beneficiaries and providers here in the next few months. We have some staff coming on board that will be leading those projects, and very excited to get the appeals going. We just got permission from the Long-Term Service and Supports Commission to do rulemaking for the third option for paying for eligible relative care. In our statute, it says that qualified family members can be paid as an individual provider, as an agency home or agency caregiver, or through a third option, and that third option is still to be determined. So expect that we will be doing some rulemaking on that, but this assignment just came through not long ago, and we're still working on figuring out how that'll work with our other rulemaking projects. We also had some language added to our statute this last year around anti-discrimination requirements and a requirement to do rulemaking on that. So we will be doing rulemaking for anti-discrimination. And again, still figuring out exactly where that falls within all of the other projects that we're doing and how to make sure that they all come together in the right time. So we're very busy here with rulemaking, but I'm always happy to receive questions, or if you do look at the recordings of past listening sessions and you want to provide some input, please feel free to still do so. I'm always happy to receive that and hear from folks. So with that, I'll stop here, and I'm going to turn it over to Sarah for a commission update.
Hello, thank you, Ariel. Like I said, my name is Sarah Cleland, and I help manage the Long-Term Services and Supports Trust Commission, or the LTSS Trust Commission. It's a 21-member oversight body for the Walk Cares Fund program. It consists of 8 legislators, 3 agency executives, so that includes the Healthcare Authority, the Employment Security Department, and DSHS. Secretary Meneses is the chair for the full commission. And then we have 10 governor-appointed positions. So these governor-appointed positions have a pretty large range that people can hold. So some examples are an individual receiving long-term services and supports. It could be a representative of adult family home providers, a worker paying the premium. There's a lot of variety of commissioners that we have. The commission meets about 5 times per year, and we host those as public meetings, so anyone is able to attend those. Each year, the commission holds work groups, which are focused on specific topics. And those work groups consist of commissioners and then agency staff. So some of the topics that are discussed, some of them derive from our statute, and then some develop from like emergent needs. And this year, the commission has 3 work groups. So we have the provider payment maximums work group. So this work group is focused on setting what the maximum allowable rate that the Walk Cares Fund will pay for all 19 approved services. We've contracted with an economist to help the work group develop these recommendations. In statute, it can't be lower than Medicaid. So they're starting with a range of that kind of being the bottom and helping to decide, do we want to stay there? Do they want to go higher? We've broken the workout into groups. Since there's 19 services, we've broken it out into 4. So the work group's still moving along, and we'll continue to have recommendations that are coming out from the work group, and those will be presented at future commission meetings. We also have the minimum provider qualifications work group. So this work group started in 2023, and they're now wrapping up their work. They've been working on setting what the minimum qualifications are for registering providers for all the 19 approved services. The work groups internally concluded their work, and it's now with the commission, and they'll be voting soon on whether they want to adopt the work group's recommendations or not. And then lastly, we have the contingency planning work group. So this work group is focused on, it came out of if the initiative were to pass. So this work group is really discussing and focusing on solvency implications if the program were to move to a voluntary design. They're thinking about short and long-term solvency impacts. And this work group is a little different. Normally the work groups develop recommendations, and this one, our goal isn't for them to develop recommendations, but to help give options to the legislature if the initiative were to pass. So their recommendations are a little contingent on what the outcome will be in November. And then we have the commission recommendations report. So this is a report that compiles all the commission recommendations for the whole year. This report comes from the commission and is submitted to the legislature by January 1st of 2025. If you're interested in more information about the commission, we have a whole section on the website where you can find access to materials, the dates for when the next commission meetings are, and all of the meetings are streamed on TVW. So there is a whole collection of them that you're welcome to go back and watch if you're interested. And then if you have any questions or anything about the commission, please feel free to reach out to me and I can be available. And that's all that I have.
Okay, thank you, everybody. So now we are going to go ahead and open it up. If anyone has questions on kind of how the program is designed and those policy updates that you got, Sarah and Ariel have to jump in about half an hour here. So we want to make sure that any questions that you might have on especially rulemaking and the commission get answered now while we've got them here to help us out. So if you have a question, you should be able to go ahead and raise your hand and I will select to let you talk and you can go ahead and state your question. We should also, let's see, somebody's got the Q&A working already. You can submit a question through the Q&A or in webinar chat as well. And we'll just read those out for you. So first, it looks like we've got Charlotte Jacobs with a question. Charlotte, I'm going to unmute you. Go for it.
I was just wondering, I'm 75 years old and I work full time. So I'm just wondering, would I actually qualify for this particular program if I needed to have any type of caregiving services?
Yeah, so the program is not, based on age in any way other than that folks who were born before 1968 are able to use that special pathway to earn prorated benefits. Otherwise, if you are working 500 hours or more per year, you're earning benefits, you're earning those qualifying years, and we'll be able to, assuming that you meet contribution requirements and need care, will be able to access benefits in the future.
Okay, I just wanted to know. Thank you.
Great. And then we have someone asking in the Q&A about whether spouses can get paid to be a caregiver. And yes, that is correct. You can make a spouse a paid family caregiver through the program, unlike Medicaid. And then we also had someone, I'm answering a couple that got answered directly, but just so that everyone can hear the answers. We've got someone asking, is it correct that the years of work started counting when contributions started? So right now, ESD is doing their own rulemaking that includes the definition of a qualifying year. We know, though, that at this point, it's looking like the definition is going to be calendar year. So anyone who worked 500 hours or more in 2023 will have earned their first qualifying year towards benefits and then started a new year in 2024. So that's when that kind of qualifying year count started. And then we've got someone asking, does it look like the approved vendors for the program will need to be Medicaid providers? I don't know if any of the three of you have an answer for that one.
Yeah, I can. The commission is working on, again, those minimum provider qualifications. So it's not necessarily that they would need to have a Medicaid provider or need to be like Medicaid contract, as an example, to provide Walk Cares Fund services. We're defining some of the services differently than what Medicaid does, and each of the services will have a different requirement. So not necessarily, but each of them are a little different. I'm happy to point people to some of the draft recommendations that the commission's worked on. I can post a link if that's helpful, and you guys are welcome to review. Again, it would still require the commission to approve the recommendations. And then they would also have to go into rulemaking. So there is a possibility that things could change between now and go live.
Thank you. Then we have someone asking if other family members can be paid as caregivers other than spouses. Yes. And I think we will also talk a little bit more about how to answer this question when we get to the communications and outreach section, when we talk about some of our kind of tough or common FAQs and walk you through some of those answers. And then we have a question about the contribution percentage, whether that will change with inflation or remain at 0.58% of wages. That number is going to remain the same. That's actually set in statute. So in order for that to change, the legislature would have to change it. And there is even like language in the statute about if there is a change made, then the legislature has to notify all participants that there's a change and what they're doing to get the percentage back down to 0.58%. So there's some pretty strong language in the statute about changing that as well. And then we have somebody asking, how old do you have to be, retirement age, and do you have to be in Medicaid to qualify for the program? There is not an age requirement for accessing Walk Cares benefits. The only requirements are that contribution requirement we talked about earlier on, and I can scroll us back through the slides to show you again real quick. So this, there we go. These contribution requirements, so you have to have met one of these pathways. And then we look at whether you need help with at least 3 activities of daily living. Do you need care? So you don't have to be retirement age in order to access your benefit. Younger workers who need care and who've met contribution requirements will be able to access benefits as well. And there is no income requirement either. It's just a matter of whether you have met contribution requirements and need care. And then we have a question about assessments. I've heard mixed information on assessments, even as far as there isn't a care-like assessment and would only need a phone screening, but it sounds like there is an in-home assessment. I assume assessing would not be on ADRC folks. Can any of our kind of policy folks on the line answer that one?
Yeah, this is Ariel. I can take that. We are planning to do an assessment, and the default will be an in-home or like an in-person assessment. We're expecting at this point to use the Get Care system with some modifications for anybody who uses it today. It won't look exactly the same, but same general concept there. There will be a telephonic or virtual assessment option for those who meet the criteria. Largely that will be folks who are already in an adult family home or assisted living facility, or who are on hospice, in which case in these situations, folks already have a care plan in place, but also services that are actively happening for them. So there will be an assessment. It will default to in-person, but there will be an option for telephonic or virtual for those who meet the exception to the in-person assessment requirement.
And then
Kristen, can I just add a comment?
Sure.
So many of the decisions about exactly how the program will be implemented, these are ongoing discussions that the area agencies are having with the Walk Cares team right now. The role that the ADRC or community living connection staff, depending on what term you're using, obviously a big role will be intake. How the role of staff will play in assessment, that's yet to be determined. And there, of course, you'd have to have people trained to be able to do those assessments, but those final decisions have not been made at the AAA level yet, just that we will have an important role in that.
Thank you, Kathy. And then we've got a question about how the state plans on addressing the caregiver shortage. This is another one that we'll talk about a little bit during the tough FAQs, more about how to answer this question. But to give you a little preview, essentially the answer is we're doing a few different things. We're working with the folks at DSHS who are responsible for providers, for recruiting more providers and expanding access to providers. We are expecting that because you can use your Walk Cares benefit for so many different things, not only specifically a caregiver, that folks will still be able to use their benefits for a lot of different things. You may want to make home modifications. You may want to get meals delivered and to get support in other ways than having a caregiver in your home. So you will still be able to use your Walk Cares benefit. We also anticipate that because you can pay a family member, including a spouse, to be your caregiver, that will expand the kind of pool of available care that people can access. And then, of course, we are working with all of the AAAs on planning around provider network to make sure that we will have sufficient providers. We are, aware of the challenge kind of throughout the state, but in particular in rural areas. And we have a team that is working on this specifically to make sure that that's something that beneficiaries are able to find providers for the care that they need. And Allie, did you want to add anything?
I just
there?
wanted to, that's perfect, Kristen. I just wanted to tag on to that as well, is that we are currently working with the provider network development and the AAAs directly, working on gap analysis for these, these issues. So we're trying to get, think outside the box, and we totally understand. And that question is very valid, but we're definitely working on it. It's on our radar for sure.
Absolutely. All right. And we have a raised hand. I'm going to go ahead and unmute you if you would like to ask your question, or you'll need to unmute yourself, it looks like, but you should be allowed to talk now. Looks like you're unmuted, but we can't hear anything. Maybe just drop a question in the chat or in the Q&A. Sorry about that. We'll give folks just another minute to submit questions through the Q&A function or raise your hand if you have a question for us still. Okay. If you do have other questions about the program, we will have more opportunities for Q&A later in the presentation after we talk about communications and outreach. We should be able to also, if there's anything that we aren't able to answer live, we can always follow up with you after the presentation. So with that, I am going to go ahead and take us into our communications and outreach information. We wanted to share kind of this overview of our current work to help Washingtonians understand the program. Our goals are really to grow informed awareness of the program, to help people understand how Walk Cares fits into their overall long-term care planning, to help contextualize the benefit so that they understand what that benefit amount could do for them, and to cultivate ambassadors to help inform others about the program as well. So we have had TV and digital communications campaigns running, not constantly, but consistently since September of 2021. Our current campaign is a statewide, it's several of the key counties in Eastern and Western Washington that is care stories that also have a portability angle. So folks who can also speak to the ability to take your benefit out of state, which is a really key message for us right now. So that is airing in the Seattle, Spokane, Vancouver media markets. And then in addition to those campaigns, we have a lot of outreach that we do from our team. We host regular partner roundtables with a wide range of community groups and business and professional groups. And we do some direct outreach to these groups as well. Lately, we've been doing some outreach to secure speaking opportunities for our director, Ben. And then we also host monthly public webinars that cover either Walk Care's basics, or we host panel webinars called Walk Care's Conversations that touch on other topics in long-term care and caregiving, in addition to providing a brief overview of the program. We do earned media outreach to ensure that reporters have a clear understanding of the program so that people get accurate information from their news sources. We send monthly newsletters and maintain a social media presence on Facebook, Instagram, LinkedIn, and YouTube. We provide an employer and community toolkit on our website. And of course, we have been doing work since last year with the AAAs on some of that local outreach. And on that note, we wanted to give you a little bit of an overview of our anticipated roles for the staff who are joining this training today. If you work in information and assistance, you likely have a more limited role at this time. We do appreciate it if you're able to answer very general questions about the program, but we consider this optional. If you don't feel confident about your answer, you are always, always, always welcome to refer callers to us instead, and we'll talk about that and where to refer people at the end of this section. But primarily, we want to make sure that you have the info that you need to direct people to the right place when you're asked about the program. And then for outreach staff, your primary role is to execute the outreach plan your AAA has developed to reach as many people as possible using strategies that you know to be effective in your area and with your staff's capabilities and qualifications. We really hope to have you all informing your audiences about key aspects of Walk Cares using statewide messaging and materials, as well as approved messages and materials that you develop. Depending on your role, many outreach staffers will need to become a subject matter expert on program basics and be able to answer a variety of high-level FAQs. But, again, if there's ever a question that you're not sure how to answer, you are still always welcome to refer people to us. We would rather have that happen than have an answer that you're not sure whether is correct given out. And then finally, we regularly tap into the outreach leads as a resource for our communications and outreach staff as needed when we are looking to do outreach in your area, or when we are looking for ways to augment and amplify the work that we are doing at the state level. Over the past couple of years, we have been lucky to be able to do several rounds of audience research to help us understand what we're working with from a communications perspective. And we wanted to share some of those results with you for your awareness. We won't be able to dig deeply into all of these, but you're welcome to review the slides in depth after the training and let us know if you have any questions. So for this first slide, we have a research partner that does regular statewide surveys. These are surveys of likely voters because of the other uses that they put the survey to. And then we occasionally contribute questions. So we've done that with this question and with the next question on the next slide several times in April, August, and December of last year, as well as July of this year. There are 500 participants, and they have quotas to ensure the survey is representative in terms of age, geography, gender, race, and education level. So these were our results in terms of awareness of the program in July. There was not much difference between there's actually has not been a lot of difference between the first time that we did one of these surveys in April 2023 and now, which, we expected to see, if nothing else, a bump in awareness as people are, looking at their paycheck and finding out about the program when contributions started. That doesn't seem to be the case. In general, the survey that we did in July showed lower awareness among younger workers, people of color, people with lower educational attainment, and people with lower incomes. That is not unexpected, but it's definitely something we are continuing to track and gives us a sense of some priority audiences where we need to continue to focus our efforts to try and get information about the program out to those audiences. In terms of geographic trends, we have seen that awareness as of this most recent survey is lower in King County and higher in Puget Sound and Eastern Washington. And then in terms of favorability, we asked about people's opinion of walk hairs. And in July, almost 60% of respondents viewed the program favorably, and only 34% viewed it as unfavorable. This is a significant increase since the last time we asked this question in December 2023. Some of the trends that we see are that people with lower incomes are more likely to have a favorable opinion, that geographically, we've seen a big increase in favorability in Western Washington, south of King County. We've seen a 12-point increase among adults ages 30 to 64, which is where we've been focusing a lot of our advertising campaigns over the past several years, and also a big increase in favorability among the populations of people who are employed and aware of the program. And then a while back now, back in August 2022, we also did some message testing and focus groups that we want to share some high-level results from. So this is from the message testing survey in which we had over 800 participants rate a series of messages about walk hairs, some positive messages as well as some negative messages that we'll see in just a moment. And we asked whether those messages made them more or less supportive. And they were also able to say, I don't believe the statement is true. If they indicated that they didn't believe the statement, they were asked how it would change their opinion if they found out it was true and given the same supportive, less supportive options. So this really gives us a sense of how believable participants found the messages, as well as how they impacted support. And they're color-coded here as kind of different rankings of how effective the messages were at shifting support. A focus on keeping people in their homes and avoiding nursing home care resonated most strongly, followed by an aspirational message about aging with dignity and independence. And then some of these other messages also were relatively effective on reducing the chances of families being driven into poverty when they need long-term care, that walk hairs may be enough to cover all or most of the long-term care that we need, and that it supports family caregivers. It looks like there's a couple of maybe some copy-paste issues on this slide, so I'll make sure to fix that before we post the slides for you on SharePoint later. And then also a message about helping family caregivers stay in the workforce was relatively effective. And then some of the messages that were a little bit less effective were talking about walk hairs as an earned benefit, talking about when a loved one needs long-term care today, it drains families' finances and hurts family caregiver careers, especially for women who provide the majority of care. What's interesting is that some of the research that our partners have done recently have actually found that a similar message to this has been really effective, talking about essentially kind of the gender gap in caregiving and the impact on women, talking about this as a women's issue. So, these results aren't necessarily the be-all and end-all of messaging. And it may be that kind of longer formulation is less effective than something shorter and snappier. And then when we look at some of the negative messages that are most impactful, so messages that are negative about the program, we find that, this was done in 2022, so fears about losing access to benefits for those who move out of state was a very significant driver of reduced support. So We're very, very lucky to have had the portability fix come through this year in the legislature and to be able to talk about that now. That's why portability is a huge piece of the messaging that we are doing this year. That's why our ad campaign right now is focused on portability, and you'll see portability messaging in a lot of our materials over the year. And then there are also some misinformation about the fund solvency is an ongoing obstacle. We've seen some additional news coverage about that this year in particular, but it has been an ongoing issue that we've had to address. You can see that 12% that's highlighted in a slightly darker color on row 3 there. Only a small percentage of participants said that they did not believe that walk cares would run out of money. So that is, when it is used, a very effective negative message. And it's one that is, you know, at this point, not true. And we'll talk about that a little bit in our tough FAQ section. But that is another messaging area that we're trying to emphasize more this year because we know that it is effective and because we know that we have a good response to it. And then in addition to that messaging survey, we did 4 focus groups in September of 2022 that were groups of near retirees, current caregivers, of LGBTQ plus folks, and then a general population group. Each focus group had 4 to 6 participants. They answered questions on their attitudes about walk cares and discussed their reactions to different messages, as well as some kind of sample creative assets. So before we showed them the creative assets, we found that participants initially highlighted really negative opinions of the program. They cited issues with initial rollout, specific downsides like portability at that point again, or that the benefit amount was inadequate. We found that their negative opinions of government programs in general really heavily impacted how they viewed the program. And also that many of them were really confused about what long-term care means, thinking that it's only long-term care in an assisted living facility or care provided for a chronic health issue like healthcare. And then during creative testing, we played several sample ads with a narrator reading a brief fictional story from a caregiver or a care recipient. And they all focused on long-term care needs being met with in-home services and supports, just based on what we had found in that survey of different messages. And we found during that creative testing that there was a really dramatic pivot from the initial negative responses to messages, that there were really strong emotional responses to those sample ads from all of our audience groups, and that they began reevaluating some of those previous views, including their opinions of walk cares and how they defined long-term care, and expanding their definition of long-term care to include in-home care. Participants really appreciated the personal story format and mentioned specific details that resonated with their own life experience, like age or the relationship status of the narrator. And as the discussion continued, they started to show more interest in some of the details of the program, like eligibility and benefit coverage. Some specific messages that were really impactful were the ability to pay for in-home care, the ability for younger people with long-term care needs to use the fund, the contrast between walk cares and Medicaid rules about savings. A lot of folks didn't realize that there were those kinds of income requirements for Medicaid, and the idea of having help to support daily tasks like cooking meals and grocery shopping, eating, getting around your house, and that kind of thing. So overall, our takeaways from that audience research were that lack of awareness is a really key obstacle, that people do have relatively positive views of the program once they become aware of it, that staying in your own home for longer is one of the most powerful messages that we have, that some of those details can really damage public opinion, like solvency and misconceptions at this point about benefit portability, that really narrowly defining long-term care can lead to skepticism about how far the benefit amount will go, and the ability of the fund to provide adequate support for long-term care needs. And huge takeaway that personal stories make an emotional impact and illustrate the value of the benefit. So what you'll see from that research and the messaging that we do, hopefully, is that we are working to expand people's definition of long-term care, that we focus on the ability of the program to keep people in their homes, that we lean on personal experiences and stories and emotion, that we, hopefully are addressing fears about things like portability and solvency to the extent that's possible. And we know that we need to continue working to reach those populations with lower awareness, especially as we reach benefit, as we approach benefit availability. We are working right now on some updates to our Walk Cares Fund messaging platform, which is a document that includes kind of all of our key messages that we go back to again and again and again in all of our materials about the program, as well as the data points that we use to back those up. This is just a little preview of some of the top line messages out of that document. But as soon as it is finalized, we will have that on SharePoint and available for the outreach leads to use in your work as well. But in general, these are the messages that we have developed and refined over the years based on that initial audience research and the feedback and what we've heard from people along the way. So 7 in 10 of us will need long-term care as we age or due to injury or illness, that most of us don't have a way to pay for long-term care and our loved ones may not be able to provide it, that Walk Cares gives all Washington workers access to affordable long-term care coverage. Walk Cares provides families with financial security and resources to make caregiving easier. And Walk Cares benefits will give Washingtonians more dignity and choice at a vulnerable time in their lives. So from there, I want to go into our frequently asked questions. These are our top 10. They're called tough questions here. They're not necessarily super tough. Some of them are just really common questions that we get, but some of them are ones that are a little bit difficult to answer. So I'm not going to read all of these answers out loud for you. You will have access to the slides later on. I'm just going to, for each question, highlight some of the key points that we try to emphasize when we're answering each question. And I'm hoping that this in particular will be helpful for the Walk Cares outreach leads who are going to be doing FAQ practice sessions through the rest of this week to practice answering FAQs in their own words. So our first question is, what if I never need long-term care? And, many people think they're never going to get old, that they're never going to need help. And some people worry that that means that their contributions to Walk Cares will be wasted. So with this question, we usually start by reminding people that they are very likely to need care, that 70% of us will, and that long-term care isn't just for older adults, that there can be accidents and things that they're not expecting that can impact their ability to take care of themselves. And we also tend to highlight some of the indirect benefits of the program because almost all workers in Washington will be covered by the program. You may be caring for a loved one who has a Walk Cares benefit and can make you a paid caregiver or get you other support. You may have coworkers or friends or neighbors who can get help through Walk Cares, and Walk Cares reduces the cost of long-term care that we all pay through taxes on goods and services. Our next question is, how long will the benefit amount last? And we touched on this with the slide earlier in the presentation. We find that this often comes from thinking about long-term care only in a nursing home. So we often use this question as an opportunity to explain that long-term care can include services and supports in your own home, and that Walk Cares is really designed to help people stay in their own homes for longer. We also try to emphasize that, some people need care for a year or less. And so for those people, Walk Cares may be able to provide all the care that they need, depending on what types of benefits they use. And that for others, Walk Cares really provides that immediate relief and breathing room so that they can plan for future care costs and maybe figure out how Medicaid eligibility works. Or, save money, or, they can find other ways to meet those needs while having immediate relief, having care and supports that they can rely on in that immediate need. Our next question is about solvency. Is Walk Cares going to run out of money before I need benefits? So the answer to this question, you'll see that the FAQ answer, it can start to get really technical when you discuss the actuarial analysis that's been done on the program. We do try to kind of summarize those findings at a high level, but we really focus as a bottom line that we're doing analysis on this consistently, that the program is currently on solid financial ground, and that there are processes in place to identify any risks that may come up in the future. And then our next question is, why is the Walk Cares program designed this way? which is really kind of a summary of several questions we get about why the program is public instead of private, or why it's universal, or universal for workers. This is a sort of slightly shortened version of the answer found in our updated toolkit FAQ that we just updated this summer. And again, this is an issue that we can talk about at length, but when giving a shorter answer, we try to emphasize that the program is based on years and years of research, and the design was carefully considered. That the design, that research looked at both public and private options, and found that Walk Cares was the only possible approach that could meet the goal of providing affordable coverage to the middle class over the long term. Our next question is what Walk Cares is doing to ensure there will be enough providers available. We talked about that during the Q&A earlier, so I won't go into detail here. And then we have a lot of folks who are confused about kind of how the program works. They're not really getting the insurance program thing, and they ask us, can I withdraw money from Walk Cares? So we do try to clarify here that it works like an insurance program rather than a savings account. We try to stress that insurance design allows us to all pool just a small amount of our paycheck over the course of our careers, and then those of us who need care can access it later on. Then our next question is whether you can give your benefit to a spouse or family member. This is another one that we get just because of people's understanding of how other programs work. And so, we try to answer it directly that no, it's only available to eligible beneficiaries, but also to point out that if Walk Cares benefits were transferable to a spouse or family member, the premium would need to be much higher. The premium is based on the benefit only being available to beneficiaries who themselves have contributed to the program. And then we get folks who are already retired asking whether Walk Cares can help them. The answer to that is no, that Walk Cares is funded by worker contributions, and so benefits can only be paid to people who have contributed as workers for a certain number of years. And we generally direct to the AAAs for more information on other long-term care services and supports in their area. And then it looks like we're maybe missing a slide. Sorry about that. Then more recently, one of the tough FAQs that we get very frequently is about what effect the initiative will have on the program. And this is a FAQ. We're going to share the full initiative FAQ document. It just has a couple questions in addition to this one with all the outreach leads to use if you get questions. It's a slightly more conservative approach to answering these questions because as DSHS and it's going to depend in your AAA what your position is. For a lot of AAAs, it's similar to DSHS where you aren't really able to speak to the initiative itself in any detail, and that really what you're going to be doing is directing people to some of these other resources that are out there. So the Office of the State Actuary contracted with Milliman, the actuarial services provider that does all of our analysis for Walk Cares, and they did an analysis of the financial impact of voluntary participation in general on the Walk Cares Fund. That's a really helpful resource to link people to. There was also a work session that the Senate Labor and Commerce Committee did on May 14th of this year, where experts presented information on the potential impacts of making the program voluntary. Milliman talked about their analysis, but there was also some really good commentary from a Brookings expert who talked about kind of why voluntary public programs like this are generally not successful and have not been successful in the past. And then there's also the OFM fiscal impact statement on the initiative, which includes information from the state agencies that administer Walk Cares. If you need somewhere quick to direct people, or if you want a little bit more language on what is in the Milliman study, there is a statement on the impact of making the program voluntary on the About page of our website. And that link is at the bottom of this slide, and that can be a good place to direct people as well. And then I just want to mention that we have an employer and community toolkit available on our site. We are working right now on updates to some of the written materials, but We have a huge variety of graphics. We have a lot of videos available. We have designed materials that are printable, including a fact sheet, infographic, and posters. We have, in terms of videos, a series of FAQ videos, a series of animated explainers, a lot of videos with folks just talking about an overview of the program and some of the key messages about the program, and of course, recordings of our monthly webinars. And so all of that is linked on the toolkit page. We just created an ASL video. We have videos available in Spanish, and many of the videos have translated subtitles, manually translated subtitles available in up to 6 different languages. So there are a lot of resources for folks who don't speak English on this page, both videos and some of the design materials. So we find that this can be a really helpful place to send people if you have someone who is looking to share information about the program with folks that they work with. And then finally, before our next Q&A segment, here is just some quick info on where to send people who have questions you don't know the answer to. Allie talked about agency roles in detail earlier, but the general rule of thumb that you can go with is that ESD is for employers and exemptions, and DSHS is for everything else. And if you have any issues remembering that, or if you need to find contact information that you can direct people to, our website's contact page includes phone numbers. You can see the screenshot of the page here that it includes details on which questions go to which agency, including hours of operation and information on language assistance and all of that. There's also an email form that will automatically route the question to the appropriate agency and to the right contacts within the agency, depending on what their question is about. So really sending people to that contact page on the website is often the most effective way to get them to the right place quickly. And with that, we are going to go ahead and open it back up for Q&A. And it looks like I'm going to answer a couple quick ones. We have an outreach lead asking about the invite for practice sessions. That information is linked in the training slide of the community of practice slides that were sent out that also included the link to this presentation. And I can resend that to you after this training so that you have that available. We've got someone asking about whether they'll receive the slides, both the recording of this webinar as well as a copy of the slides will all be on SharePoint. Hoping to get those up today after the presentation so that you'll be able to access those. And then I've got someone asking about working with seniors over 60 years old, how this will work for recent retirees and those that are about to retire and have met their minimum of 3 years of contributions. So for folks who are recent retirees, if they are truly not working anymore, they are not going to be able to qualify for benefits because WalkCare's benefits are for folks who have contributed and met these contribution requirements that I'm scrolling back through too. Sorry for making you dizzy. So you do have to meet one of these contribution requirement pathways in order to qualify for WalkCare's benefits. So for folks who are truly retired, not working, they're not going to qualify for WalkCare's benefits. For folks who are near retirement, there are a couple of ways that they may qualify for benefits. They may, if they need care soon after retiring, be able to qualify through this middle pathway, the early access to the full benefit, where as long as you've contributed at least 3 of the last 6 years at the time that you need care and apply for benefits, you're able to access the full benefit amount, as well as folks who are born before 1968 earn that prorated benefit that they have access to permanently. So they're not going to lose access after they haven't worked for 7, 10, 15 years. They will have permanent access to 10% of the benefit amount for each year that they work. So if you work 3 years, you have access to 30% of the benefit amount, and you can access that at any point in your life that you need care, as long as you were born before 1968. And then we have someone asking if an employee at age 59 started contributing in July 2023, will they be eligible for the full benefit if they retire at age 62, working 500 plus hours from 59 years of age to age 62? So that would be 3 years of contributions. So they would be eligible for the full benefit only if they meet the contribution requirements in this middle pathway, early access to the full benefit. So they would need care soon after they retire. However, somebody who is 59 is probably also going to qualify for the near retiree pathway. So they would earn, if they've worked 3 years, 30% of the benefit amount that they could access at any point in their life when they need care. Then we have somebody asking if someone has 2 jobs, can they contribute through both jobs? Yes, they should be contributing through both jobs. Almost all workers in the state. There's this slide that Allie showed earlier on that talks about who contributes. As long as you are a worker working within Washington and don't have an exemption, for the most part, you are going to be contributing through any and all jobs that you have. And then question about state legislators, whether state legislators are aware of the AAAs as local information outlets for walk cares, or do we need to let them know through our outreach efforts? That's a great question. I think it probably depends on the legislator. We have not had communication with state legislators about the AAAs as a resource. So that may be something that you would want to reach out to your local legislators' offices and offer support if they have, folks with questions. They usually send them through us, which is, also great. But that's a great question. I think that is probably an area where you would need to reach out and let them know that you're available. And that gets us through everything in the Q&A. I don't see any raised hands. Are there any other questions that folks have? Just give a couple more minutes for anything else to roll in. And as we're getting close to the end of time, I will just let you know that there should be, hopefully, if it works correctly, a survey that pops up after you're done with the training and in your follow-up email that you get after the training. We really appreciate it if you could fill that out and just let us know how helpful the training was, what was helpful and what wasn't helpful, so that we can, we're going to be continuing to offer this training for AAAs likely once again in the fall and then on some kind of a regular basis going forward. So your feedback on what's useful for you, super helpful so that we can continue to refine the presentation to meet the AAA's needs if you're able to fill out that survey. And I'm not seeing any more questions come in. So I think with that, we can go ahead and conclude the training for today. Thank you all so much for joining us. We will let you know when the presentation materials are available on SharePoint. Again, hopefully that'll be later today. And we're going to continue populating that SharePoint site with materials over the course of the next probably week as we get some of our materials updated and as we have things like the training recording available. So more to come from us very soon. And again, thank you so much for being here with us. We really appreciate it. Have a great day, everybody.
Thanks, everybody. Thanks, Kristen.